Today we're talking about saving that money. Woo! Who doesn't want to be a smarter healthcare consumer? We all want to save money. I was telling Sherry, I knew nothing about healthcare, starting like my first job. I would just give my mom that packet of papers and be like, help figure this out for me. Like, it's really confusing when you're not in this industry, I think. So, this presentation is intended to not only help you save money with your healthcare, but also understand what the heck you're choosing. So thankfully now, especially working with Sherry and, the whole HR team, I've learned a lot about this stuff, but you guys don't all have that luxury. So I'm here to help teach you, and so is Share Bear. So let's get to it. And the first thing we want to make note of is healthcare decisions should never be made solely because of cost. Obviously, your health is the most important thing, not just saving money. So that aside, we're going to talk about how you can save money. And I'm going to have Sherry start you off with telling you about the different plans we have here at Famous.
Right, yeah. So the first part of that whole bit is making the correct decision for you. So just to give you a brief overview, whenever you're thinking about what you're going to choose, there's a few things that you should think about. The PPO is going to have that a little bit higher premium every pay, but more of your routine healthcare costs are covered by those small little copays. This option is generally better for people who are suffering maybe from chronic health issues where they need that reoccurring visits, or maybe if you have young children and you're doing those consistent check-ins, or if we all are back in school, they're around all those other kids with all those other germs, and that generally means you're going to the doctor more often. The high deductible plan has the lower premium, but it has that more upfront out-of-pocket costs. That's better choice for people who are generally healthy and aren't suffering from those chronic care issues that need those frequent visits to the doctor. You can see the prices there are considerably different between the PPO and the high deductible. There you go. So things to consider, the breakdown goes as such. The PPO there on your left, you can see that there are contracted rates for copays for different prescriptions as well. So you get that benefit paying that slightly higher premium, as opposed to the high deductible, you're paying that out-of-pocket deductible, and then you are paying that co-insurance after your deductible has been met.
So hopefully you guys all know what this is, your wellness form. These all need to be in by October 1st, 2020. So they extended the deadline a little bit for y'all just because of everything that's been going on. So it's really simple. All you got to do is get your doctor to sign this form. If you need a copy, I'm sure your manager or HR, we can get it to you. All your doctor needs to sign it. You can either return it to Jess in HR, Sherry's daughter, pretty little blonde girl, or you can have your doctor fax it, or you can email it to Jess, okay? So just so you know where it goes. I get a lot of these sometimes, and I'm like, oh, that's not me. But all good. So yeah, so you don't have to write any numbers on there. All your doctor has to do is sign this, and your wellness visit will be 100% covered by your insurance, our insurance provided by Famous. So no need to worry about, having to pay, whatever the wellness service will be covered.
One more thing about that too, Caitlin, like you were saying, we did extend that deadline a little bit. The form still has to be turned in by October 1st, but if you are unable to get your visit in prior to October 1st because of COVID and having had a lot of doctors' offices not seeing patients, we extended that. If you provide us that at October 1st, saying you have an appointment between October 1st and November 15th, you still have till the 15th to get it in again with a signed from the doctor's office that you've completed the visit. But the form is still due the first time, October 1st.
And I want to clarify here as well, the preventative visit isn't covered by Famous, it's covered by the plan. So if you're on the plan, the preventative visit is covered.
Very good. All right, so now we're on to planning your visit. So it's time for you to go get that visit in. There's a few things you can think about before you're gonna go in. You're gonna use the insurance website. If you're on our plan, we want you to make sure that you're thinking about who is in network and who's out of network. So use the MedMutual site and you can determine who's an in-network provider for your primary care physician. It also can help you determine who's in network for labs and facilities. That is generally going to be much less expensive. Make sure that you're making an appointment for your routine preventative exam and get all of the tests done that your doctor's recommending based on your age or your gender. Make sure you get those taken care of each year and be specific about the services that you want to receive, how they're going to be coded and billed, and will they be paid via the insurance. And then make out a plan for your questions to ask the doctor while you're there.
So I'm going to show you guys really quick how easy it is to do this. If I can find I guess I'll just stop share and do a different share. Why is this not showing up? Can you guys see this? Can you see the website right now? No, it's like literally on my face, isn't it? Oh, here we go. Yay. All right. So I'm going to show you guys literally this, like, okay, you don't even need to know the website. So literally you could type into Google Medical Mutual Ohio. Here it is, pops up, first one. Then you can sign in, and already signed into my account. So when you get into your account, if you scroll down, it shows find a provider. So you can click here and use the search engine and you can find someone that's within your network, because the key here is you do not want to end up going to a physician that is not covered in your network, because they're going to cost you an arm and a leg. So you can search here and physician facility pharmacy to find someone that's provided near you. So that's a really awesome tool to know how to use. I'm going to go back to the presentation. Great. So these are some questions you can ask your doctor. You know, you're going to the doctor, you want to make sure that you're getting the most out of this visit. So, you know, ask questions and do not be afraid to ask questions. And if you are afraid, write them down before going. So these are some questions you can ask. Are my numbers normal? Weight, blood pressure, any vitals, whatever they, you know, any tests that they're doing for you, ask if they're normal, because a lot of times we don't know. And with the way medical charting is now, they're typically not going to call you if something is normal. They're only going to call you if something's abnormal. Do I need any additional screenings or tests? Do I need to see a specialist? Any immunizations? Are my prescriptions okay? So do they need to be adjusted? How concerned should I be about something? What can I do to stay healthy in the future? When should I come back for another visit? How do I see my results? Or does my family history put me at risk? Great tool. If you don't know this, most healthcare providers are doing a lot of online charting now. So if that's new to you, definitely something to ask your doctor about. But it's awesome because, I mean, me personally on mine, I can see my blood results since I was like in high school. So I think that's pretty cool. Sherry?
Yeah, thank you. I keep, our faces are moving around and in the way of what I need to see. I'm trying to move the people's names. So I can't see them all. Hold on.
Does it help if I move this down here?
No, I need to get the people. Okay, there you go. That's better. All right, so during your visit, there's things you want to think about. Ask how things are being coded, because your preventative items are covered items. Diagnostic items can be covered. And by covered, I mean being addressed by the insurance. It's not going to be sent back saying these are uncovered items. So diagnostics can be covered at a percentage or have a copay or co-insurance or deductible, but preventatives are covered at 100%. That's part of the contract set up behind the scenes for the insurance provider. So if you go in and you're saying, oh, I'm here for my exam. Oh, and by the way, I think that I'm also feeling really exhausted. Maybe I'm a little anemic. And they start adding other things to your blood work. Those become diagnostic items. And then that preventative blood work has now become a diagnostic blood work. So make sure you're having those conversations so that you understand. Don't avoid addressing those issues, just understand that there are going to be things that may or may not be covered as preventative. If your doctor recommends those procedures, like blood work or an x-ray or an MRI, and it's not urgent, because if it is urgent, take their advice and do it when and where they say. But if it's not an urgent, ask if you can have those done at an in-network lab, because sometimes those doctors' offices, blood work, people, their phlebotomists may or may not be in network. You should also ask if your prescriptions or medications are available in generic. Sometimes the doctors have met with a farm rep and they are offering you the new fangle dangle thing that's out there. So ask those questions. Is this a brand name or is this available in generic? Then after your visit, you're going to want to go back and do some double checking. Make sure that the coding came through the way you expected. Ask for clarification before you leave the office and really understand how these things are going to be sent over to your insurance. You should also consider getting a second opinion if they're talking about really complex things, things you don't understand. You may want to consider talking to another doctor to see if they also believe that those types of diagnostic procedures are really necessary. Pay attention to your healthcare bills when they come in. Look over your explanation of benefits that you'll receive from Medical Mutual if you're on our plan, and really understand those things. Make sure that they all look like they match up. And if a procedure has been recommended, your doctor's office should be calling the insurance company for pre-authorization. But you should call to make sure that that has been done prior to this procedure. So don't just assume that because the doctor's office said, oh yeah, we'll get a pre-auth done for that, and then show up for your expensive procedure. Make sure you've made that phone call to know for sure that that all was completed and everybody on both sides has everything that they need.
So what on earth is a pre-authorization? So this is basically the insurance company approving your procedure. So just because your doctor recommends something doesn't mean that the insurance company is necessarily going to approve it. So this process is called the pre-authorization process, and these are some other terms that might be used, pre-certification, predetermination. So you know, typically your doctor should, like Sherry said, be reaching out and getting the pre-auth, but you do need to confirm that it has been done. And, you know, I used to work in long-term care, and, you know, these are tough because I would have family members who, you know, had, you know, their elderly family member in long-term care, and their coverage under insurance would be ending, and rather than getting that pre-auth for an extended stay, they would leave their family member in long-term care, and then their stay would get denied, and they would be in the hole tens of thousands of dollars just over the course of a few days, because that's how much it costs without insurance to be in, you know, long-term care. So, you know, these are important, especially if you're getting an expensive surgery or procedure done.
All right, so claims. Claims is one of those things that just kind of happens behind the scenes. A lot of times we don't even think about it until all of a sudden you get a bill that you don't understand, and then you have to think about it. So it's important to know that insurance companies may deny a claim. You can get a an explanation of benefits that comes back saying we're not going to pay for this. Those decisions can be appealed. There's an appeal process, and you just call that number on the back of your card, whoever your insurance carrier is, and they can walk you through that process. Another thing that can happen is the physician that you've seen for that service can provide a letter to the insurance company, or in Medical Mutual's case, they call that a peer-to-peer consult. So they will actually set up a time with that provider to review the procedure and why that physician deemed it as medically necessary. There's another option that you have, because FAMOUS provides for everybody Health Advocate, and it is a service that is just what it says. They offer to be your advocate when dealing with your claims and lots of other things. But you don't have to pay for that. We provide it to everybody, and you can call them and give them permission, and they'll do the work for you.
So I told Sherry I wanted to talk about my Care Compare because I'm very passionate about it, because they saved me a lot of money. So back in like, I think it was May, I thought I had a stress fracture in my foot from running. So I went to the doctor, and of course he was like, get an x-ray. So I went on my Care Compare, looked at how much it was going to cost to get an x-ray at the Cleveland Clinic. It was going to be like $250 or something like that. And I was like, oh, no, we're not doing that. So I went on my Care Compare, found a radiology clinic here in Beechwood where I got it done. And I think it was $25. So 250 versus 25. I mean, that's just like amazing for the same exact thing. All they're taking is a picture of your foot to send to, well, in my case, a picture of my foot to send to the doctor. So this is really cool. So this is a tool that's on Medical Mutual's website. And these are some examples on this slide of, different cost comparisons. So another kind of way I got conned with this was like a lipid panel. I like to get my blood lipids looked at every doctor's appointment, just because it's something that I'm curious about and like to know. But unfortunately, I think they're only covered like every 5 years under my insurance for me or something like that. So I had to pay the big buckaroonies for that, getting it done at my doctor's office, when I could have gone to an independent lab and got it done for $11, like you see here. So definitely a really great tool when you have, different tests specifically that you want to check out. Oh, and I'm going to show you guys how to do this on the website again. So we go, so back to Medical Mutual's website. Okay, maybe not there. So you literally, over here on the side, right here, My Care Compare, launch now. And you can type in your location. Oh, that's Cleveland, Ohio. So let's say lipid panel, pops right up. Search. So I could go to pathology laboratories and get this done for $6. That's crazy. $6 versus, these just go up and up. Isn't it crazy that some place can charge you $6 while somewhere else can charge $110 for the same thing? What you're really paying for is the facility. So like these are at the big hospitals here, UH Ahuja, UH Cleveland Medical Center, UH Rainbow Babies, so that's going to cost you if you want to go to their facility. So this is a really, really great thing to know. So I'm going to give you some more examples of that. So, blood panel, we've got $6 versus $110 at Akron Children's versus UH Portage, $160.
That's crazy.
MRI. Ooh, what?
I said, it's just crazy. Blows my mind.
I know. It's robbery. MRI, we've got $2,200 versus $2,900. $700 savings. A lot of other things I'd rather spend $700 on. So, obviously when it comes to these stuff, like physical therapy, obviously read the reviews of the provider, like this, I'm sure you can look up your physical therapy provider, read the reviews, make sure that they're great, but also not have to pay $150 versus $40. Knee replacement, I mean, it goes all the way from $15,000 to $52,000. That's crazy for the same exact procedure. So emergency visits, this is another place that you can really save money.
Yeah. The, of course, we want to always remind you that we want you to err on the side of caution. Your health and safety is the most important thing. It's just when you're evaluating whether or not do I need to go to the emergency room. So if you are able to call the nurse hotline and ask if they recommend the ER, if they do, then Medical Mutual will not deny that claim based on a non-emergency, because that is a reason for denial. If they deem that you went to the hospital for something that would have been just fine to wait on or to go to an urgent care or another, like your primary care physician, then they can deny those claims. So, but if you've already called the nurse hotline, you've already been given the green light from that company to go ahead and go, it does prevent that denial. So, you know, you do want to avoid the emergency room for non-emergent issues. So assess that, you know, can I wait to see a primary care physician? Could I just use telehealth? Can I use an urgent care or a minute clinic? And if you can save time and money at an urgent care or seeing your provider, that of course is better for your bottom dollar. So there, Caitlin has provided you with the nurse hotline number. You can stick that in your cell phone so that when you're in those moments and you're just not sure, you don't have to have that magnet on your refrigerator. You'll have it right there in your phone.
Yeah, do it right now. Right now, I mean it. Literally, my boyfriend had like a allergic reaction. He's allergic to bees, but he ate honey, and for whatever reason, that gave him an allergic reaction. And this number came in handy because I was like, what the heck do I do? And they were like, ER, because he needed to have epinephrine. He would have had to go to the hospital. So like urgent care for him wasn't an option. And I'm glad I had this number to help me out.
Yeah, that's awesome. So in this slide is just, we want to make sure that you're aware. So the differences in going to those different types of offices. If you're on the PPO, to walk into that emergency room, you've got a $350 copay per each visit. If you went to an urgent care, it would only be $100. If you needed to go to your regular primary care physician, it's $35. If you are on the high deductible, you are having those out-of-pocket expenses up front until that high deductible has been met. So it is more important that you are safe and that you are healthy and you are taken care of as emergently as you need to be. But just, we don't ever want anybody to choose the emergency room because it seemed like the easiest thing to do. Just think about those choices if you have room to do so. And this is a chart that we're going to send out. Caitlin's going to send it out at the end of everything. This is something you can have, you know, hanging on your refrigerator. It's that quick reference. Okay, if I am having an allergic reaction like Caitlin's boyfriend, what are my options? So he could go to the ER, urgent care, or wait for a primary care physician. This is a good time whenever you have three options there. Why don't I call that nurse line and let her help me decide which one of these to do? Of course, if you're bleeding heavily, just go to the ER. Don't wait. This is just a helpful chart. Something maybe we should even, I know we have some hanging around the office, but maybe even at the branches, it wouldn't be a bad idea to have posted for people to be mindful of what's wrong, what do I need to do next?
Yeah, I think the main message to get across, especially, is that like a lot of times what you think might be needed to go to ER, a lot of times you can go to urgent care for that and really save yourself a lot of money, especially looking at those copays on the last slide. So, and you know, it's important to reiterate certain conditions like heart attacks, strokes, severe trauma, they're time sensitive. And a great example I can give of this is strokes. You know, if you go to the ER within 3 hours of the onset of stroke symptoms, they can actually give you a medication that breaks up the stroke and reverses any sort of negative health effects that you've had or any damage that's been done. So in that case, absolutely, do not think twice. Go to the ER if you're having any sort of symptoms of that. So I really want to reiterate that because that could really save your life if you're on top of it. So never ever ignore your symptoms or put them off, because that's important. And obviously you want to prevent that. So, you know, in those cases, the faster you get there, the better for you and the better for your health. So this is a super cool program. If you or one of your family members that's on the plan has any sort of chronic disease, potentially they can qualify for this program. It's especially great, you know, like they literally provide free diabetes testing supplies. So if you're in a pinch, can't afford the medical supplies that are provided on your plan, this is a great place to reach out to. And they have other stuff too. And there's no out-of-pocket cost. You just have to qualify. They have education. They have like health coaches that'll work with you too, and give you tips to help you manage your condition better so that you can live the longest and best life possible, right? The goal.
Okay, so now we're going to talk a little bit about medications. So it is important that we think about shopping for prescriptions just like you would shop for anything else. Do some RX price comparison and shopping. You want to research any available manufacturer's coupons. So like if your doctor says, no, this is the brand name, this is not available in generic, but this is really what we need to be using, that's your cue that you want to ask the doctor questions. Are there any coupons? Do you have any samples? Do I have time? I can go look online and see if there's manufacturer's coupons I could take with me to the pharmacy when I get this prescription filled. But then otherwise, I would ask, is this available in generic? If I use the mail order system, was there a discount if I get a 90-day supply over a 30-day supply? And again, ask your doctor for samples. Be aware of the difference between local retailers and discount programs. Using, like Caitlin showed you on the My Cost Compare, it's very similar. At the bottom of that screen, you can click to connect to the Express Scripts, and it will let you shop there. And you can do the exact same thing for prescriptions as you would do any other kind of procedure. And then always just make sure you've talked to your doctor, understand all the options. So if they suggest some very expensive procedure or therapy, ask, what are our other options? Which would be best for me financially? What matters is that you are completely taken care of, but without breaking the bank. And this is a sample of GoodRx. So you can go to goodrx.com or you can download their mobile app. It is unbelievable. You can go to the pharmacy and you can walk up with your phone. If you have this on your mobile app, you can look for the drug that you're being prescribed, put in the dosage that was written on the prescription, and show the pharmacist and say, which is cheaper? Is it cheaper for you to run this through my insurance, or is this GoodRx price better? And it varies. Some of those coupons change. The mobile app, I know, will even store that coupon for you, so that if you've used that this month and you know this is going to be something I have to do every month, the next time you go to the pharmacy, it's stored right there. You just pull that coupon back up and do the same thing all over again.
And if your doctor, sorry.
Oh, that's good.
If your doctor prescribes you something new, so say your doctor is like, I want to try giving you metformin, you know, those doctors have medical sales reps coming to them all the time, beating their door down, giving them free samples, trying to get them to try their medications. So absolutely, before starting a new medication, ask him if he has any free samples, you know, because a lot of times your doctor might try you on a medication. After a month, you realize it's not working, you don't like it, whatever the case, you just saved yourself a lot of money. So absolutely ask your doctor for, you know, free samples. If he has them, great. If not, whatever, you know, just another way to save that money.
Right. And here's an example of that. So this is the link that you go to from the Medical Mutual over to Express Scripts. And this Toprol is just a very common high blood pressure medicine. So just to explain what you're seeing on this screen, if you type in Toprol, it's going to give you these options. That little exclamation warning yield sign in the middle is telling you that there's something else that needs to be noted here. So this is a brand name drug. And if you clicked on that, it would probably take you to a little blurb that's going to explain this can be covered paying, costing you $107.84, but it probably has some conditions. So they're going to want to know that the doctor has tried other methods, that there's other things that you've pursued, and you're down to last resort, I need to use this medicine. Or if you are able to use the generic instead, you can see down there at the bottom, is this drug covered? Yes, it is, and it's only $17.84 for a 90-day supply, or $9.80 for a 30-day supply. So you can do all this shopping up front, ahead of time, and no surprises when you walk up to that pharmacy counter. And then here's Health Advocate. So we touched on this before. Health Advocate is the service that Famous pays for all of our associates, just to help you navigate your healthcare better. Of course, I'm always here, HR is always here, and we're happy to walk you through this, but this helps you be able to navigate so much of that personal information that is really none of our business, your details. We're happy to listen and understand and help you walk through all of that if you would like to share that. But this gives you an opportunity to very safely, privately seek out an advocate that will help you achieve all these different things that you see listed here on the screen. One of the most common things that I see our associates using it for, though, is when you get that explanation of benefits and you're like, what does this even mean? This doesn't look anything like I thought it was going to be. You can call Health Advocate, give them permission to look into it for you. And then instead of you having to call and sit on hold for hours at a time while you get connected to the right person who's researching it and going to get back to you, and then you're waiting for them to call you back, somebody can do all of that for you and you can just go about your day. It's just an amazing advantage. I don't know of any other company I've ever worked for that has provided this kind of a service.
And then we have PHA. I'm sure you guys have heard of it mentioned. So this is Dr. Arman, who is actually Kevin and Brian's uncle. And he's a doctor, and he's basically kind of like he's an unbiased third opinion, basically, or additional opinion, I guess I should say. So if you have, a diagnosis that you're like, I don't know if this is right, or I don't understand this, or, what is another option than this procedure they're recommending, you can call him and he'll give you his opinion. He's not making any money off of you, doing this, calling him. So he's going to give you, unbiased, what is the most beneficial thing for you. And, he's very, very intelligent. So, you can rely on him being a good source of information. So definitely take advantage of this. I know a lot of people have taken advantage of this when they've had procedures recommended. So, doesn't hurt to ask, right? So this is how you get a hold of him, this card, or you can call. So yeah, cool stuff.
All right. So FSA is another way that you can save money. And I think a lot of people don't jump into these because maybe it seems a little confusing. So hopefully this just breaks it down a little more simplistically. So it allows you to set aside pre-tax money for near-term health expenses. So things that you're going to be taking care of over the next year. You do not have to be enrolled in our medical plan to be eligible for this benefit. So if you are on a spouse's plan somewhere else and it is a PPO type plan, you can sign up for this separately here at FEMAS. Another thing is you cannot be enrolled in the high deductible plan. And if you are enrolled in a high deductible plan with your spouse, you cannot participate. So funds generally must be used within that calendar year. Money that is not used in that year is lost. So I know that sometimes is scary and you think, oh no, but you do get that money funded at the beginning of the year, so you can budget that out throughout the year. And there is a little tiny bit of a grace period, generally speaking, at the end of the year to get that previous year's expenses tidied up. The FSA dependent care is very specific. That can be used for daycare or for elderly care. If you are taking care of an elderly parent and you have to have them in like a day program, you can have that money set aside and get that tax break to pay for those expenses. The other thing I will tell you that, and the annual maximums are listed down there too, and those generally go up just a tiny bit every year. But it is so important that you save your receipts when using a flexible spending account. There are very strict IRS guidelines based on what can and cannot be used as an FSA expense. And you just need to make sure that you've kept every single one of those keep good medical documentation.
Yeah, I think this is really cool. So literally, if you have to pay $500 for daycare at the beginning of the year, rather than having to pay that all up front, you can, put it in, pay for it monthly through the FSA, but they will give you that money up front. Correct, Sherry?
Correct, exactly.
Yeah, so rather than having to pay it all at once, through your paychecks in the FSA, you will be doing a payment plan without actually doing like having to do interest or anything.
Exactly.
yeah, so it's a good money saver. So then there's the HSA, which is similar. This is what I have. So you cannot be on, you have to be on the high deductible plan if you're doing this. So this is what I do. And it's really great, I actually think, because, you know, you choose how much you want to put in. So I can't remember how much I put into mine. Everett talked me into it because I was like, I don't know what the heck this is. I don't know about this. And Everett was like, come on, just do $10 or something like that per paycheck. So I was like, okay, fine. And it actually ended up coming in handy because I had like a $200 bill for my doctor's appointment and x-ray and everything. And I think I had more than that in my HSA account built up through paychecks. So rather than having to pay $200 up front, I had this built up in my HSA, and the HSA does collect interest. So you can, you know, generate income from this, and it never goes away. You won't lose it. You just can use it. But it does have the maximum that you can contribute. So $3,500 per year for a single, or $7,100 for a family. So I think this is super cool. But if you do ever switch plans to the PPO, you can no longer contribute to the HSA. So you do have to be on the high deductible plan is the thing here. So for someone who maybe doesn't have huge healthcare costs year to year, but might have like 1 or 2 appointments a year that they want to save for, so they don't have to pay it all at once, this is a great thing. Or just to save for the future. You know, the way I look at it is, you know, maybe I'm not really using this money right now, but someday I might need to. You never know what's going to happen. You know, if I break my leg and have to pay for a surgery, well, okay, I'll have this money saved up here that's not getting taxed, and it's actually growing interest. You know, it's a pretty good investment.
Absolutely. Okay, so this slide is about our MERP program. MERP is another very rare program. Not many employers are going to have provided a medical expense reimbursement program. So recently our plan has changed names. It's still the same company. So if you were involved in the MERP program before, don't be alarmed. You will start getting mailings and things from Catalyze Health instead of J&K Consultants. Something that is important to know is that you are eligible for MERP as a new hire, or if you have been on our plan for over a year and maybe something happens or it's open enrollment and you're like, nope, now I can go off onto my spouse's plan. Maybe your spouse recently you know, got a new job and now has benefits, and you've been on our plan for over a year, you can switch to your spouse's plan and then join the MERP plan. And what the MERP does is the plan will pay you for a difference in premium. So if you're thinking, oh, well, it's more expensive to go on my spouse's plan. Well, is it really? Because if you go onto their plan and you sign up for MERP, Famous will pay you the difference in premiums for you to go onto that plan. We also, the plan will pay all your copays, your co-insurance and deductibles to cover any of your out-of-pocket expenses. And those they come in like, I think once a month. I know the premiums come in once a month, and then the copays, co-insurance and deductibles, I think come at a separate time once a month. And you can receive a little card. You can take it with you to the doctor. If the doctor says we don't do that third-party billing, that's okay. Just keep your receipts and you submit this simple little form and you'll get that reimbursement back. As long as those were expenses that would have been covered under Famous's plan, we will cover that out-of-pocket expense for you.
Yeah, MERP is kind of confusing, but luckily we have Sherry to help us understand. And then real quick, I wanted to touch on Medicare. I didn't know this myself. I told Sherry I had to tell my dad because he's almost 65. If you do not enroll in Medicare by the age of 65, they will start penalizing you. So I forget what the numbers are. I was going to put them on here, but it was too much. But it's like every month or every year that you wait too long, it's hundreds and hundreds of dollars more that they're going to start adding to your monthly fees or whatever it is. So just make sure you're enrolled by 65. That's all you need to know, okay?
That's a good sum up.
Yeah.
Just do it.
Yeah, just do it. And obviously, you guys all know this. This is what I'm preaching all day long. Preventative healthcare and improving your health are key. I know sometimes healthier foods cost more upfront, but guess what? You're going to pay for that in your health later on if you're eating, low nutrition and poor quality foods. Food is medicine. It's the most natural form of medicine in all of Chinese medicine, and the medicine we've been practicing for hundreds and hundreds of years. That's the initial way that we started treating people. Yes, we have advanced medications now, but why go there? You know, save yourself the time and money and start now. Start living a healthier life so that you don't have to go, you know, to the doctor to get, you know, medications for preventable diseases. So, and, you know, another aspect of this is knowing your numbers. So like I said, even though, you know, I'm young, but I still want to know what my blood lipid levels are every year. So I know, okay, if my cholesterol went up, what do I need to change? What have I been doing? You know, thinking back, like, what have I been doing that maybe made my cholesterol go up? Because that's based on diet and habits, you know, exercise. Are you drinking water? Are you eating nutritiously? Are you, you know, that type of stuff. And then obviously preventative exams. So we were able to see through our health insurance claims, like something about like how many people are doing preventative exams, and the numbers were not as high as they should be. You guys, this is so important. I know no one wants to do a colonoscopy. I know it's not a pleasant experience, but I promise you, having to deal with colon cancer and chemotherapy is a lot more unpleasant experience. So, and it's a completely, you know, preventable disease if, you know, you catch it early on. And that's why this is a mandated procedure for people. What is it? 55, 50, 45, 50?
50.
Yeah, 50, sorry. Yeah, and that's why this is a procedure that they encourage you to get at this age. There's a reason for that. It's not just like, woohoo, just do this procedure to torture you. No, there's a reason for that. Okay, so improve your health. You're going to have to take less medications. You're going to feel better. You're going to have less chronic disease, less complications, longevity, which is what we're all in search of, you know. So it's a no-brainer, right? And, you know, that's why I'm here to support you, of course, because I know, obviously, yes, it's a no-brainer, but putting it into practice is a whole nother story. And that's why, you know, people are 80% more effective when they have someone who's a partner to support them in these type of journeys. So that's why I exist. I'm here. That's me. I got you. So, and you know, the last little component to this is that based on how famous does our healthcare insurance, we are self-insured. So if we all get healthier as a group, we all save money. And I'm not saying that to guilt trip you. I'm just saying that, you know, if we all want to save money, let's encourage each other to get healthier. Let's do it together. It's, you know, we're all in this together. We all want to save money, right? We all want to save money. That's, you know, who doesn't? So, you know, let's all get healthier together. And obviously an important part of that is quit smoking. This is like, so like, this is crazy, you guys. So a non-tobacco wellness associate pays $1,800 for health insurance yearly. And a tobacco wellness pays $4,800. Non-tobacco pays $6,015. So I just kind of calculated this out. One pack of cigarettes a day, $7. I don't know what cigarettes cost, but that's what the Google told me. So calculating this out, if you have a pack of cigarettes a day on the wellness plan while smoking, you're costing yourself an additional $5,574 a year. So that's in addition to the, you know, base cost, okay? And if you're on the non-wellness plan, which I don't know why you wouldn't not fill out that wellness form. It's so simple and easy. $6,700 additional cost. Think about that. You could buy a new car. You could buy a boat. You could buy, so you could go on a vacation, go around the world, go to, I don't know, Japan. I don't care. Well, maybe not right now because of COVID, but someday think of all the things you could do with that money, and instead you're paying it to, you know, cigarettes. Okay. So, you know, obviously I say do it for your health, obviously, but if you won't do it for your health, do it for your wallet, okay? And this is the quit line. So to give you some support, some people talk to me about smoking and I'm like, well, I'm not like exactly the expert on that, but you know, obviously I'm always happy to like support anyone in that type of journey. But this is the quit line. These are people that are trained to help you with, you know, quitting tobacco and living a, you know, a smoke-free life. So, oh, and they can also, I think Sherry, you told me that they can also give you like nicotine patches or something like that.
Yeah. Yeah, they determine based on consultations that they have with you. They develop an individual program of what will be needed to get you off. So yes, they provide different things based on whatever it is that your addiction consists of. And the other thing that's really important about this is so many people are like, oh, no, I quit. For me to be able to help save you the money mid-year, I have to have from this program a certificate that you've done the program and walked through all that so that I can make your change mid-year. Otherwise, Medical Mutual will say to me, oh no, you have them as a smoker. That's what they are until we have proof of something different. So we want you to quit however you can. However, to save those dollars, do the program.
Cool. Oh, and this is just our insurance structure, just in case you guys didn't know this. So like traditionally, like Famous would pay an insurance company a fee. Say it's, I don't know, $2,000 per associate per month or something. I don't know. This is totally skewed. Whatever. They pay $2,000 per associate for the year. And the insurance company pays the hospitals, the pharmacies, the labs for whatever procedures you're having done. Okay. But in our scenario, we take the insurance company out of it. So Famous is footing the bill for any procedures that are done. The idea here is that, well, we do not pay the same fee consistently. So rather than it being $2,000 per person, it might be $3,000 some months and $1,000 another month or year or whatever. The idea is that, some years we'll save money, and if we all get healthier as a company, we'll save money. And that goes right back into your pocket, because then they can reduce our premiums and save us all money. So
right.
Fun perk of that.
Absolutely. And so whenever if that makes you think, well, then why do I deal with Medical Mutual? And the reason is for your privacy, and for administration, we use them as just a third-party administrator. So they are just funneling. They are receiving claims, and then they're saying, hey, Famous, you owe us this much. So it's not that we're looking at your claims. We don't see what you're doing. We just pay the bill directly for that instead of paying a blanket insurance policy.
Yeah. So this is pretty rare. Like, not a lot of companies are self-insured, right? So yeah, it's kind of a cool benefit. So if you have any questions, comments, concerns, well, first, before you do anything else, go to myfamousbenefits.com. Who knew this website existed? I didn't, but I discovered it recently, and it was so helpful in putting together this presentation. So obviously go there first, look into your MERP there, look into the benefits there, and then if that doesn't answer your question, we've got our beautiful Sherry here ready to answer your beckoning call and help you out in any way you need. And